Thank you. So, so yes. Now let's see here. Dr. Surendra. So we are,
Sir.
yeah, are you ready?
Yeah.
Hello and welcome to Seven Sentinels. This is Grandmaster Class and I'm Peter Simon with you. Right. So this is Dr. Surendra Muppuraju from Ongole, Andhra Pradesh, India. He's a doctor who's pursuing his medicine from Singapore. Am I correct? Singapore, right?
No, Philippines.
Philippines. And he has come for a break now. Okay. So he's pursuing his OET with me. Right. He has taken the suggestions very seriously and he's been improving a lot. Really, I appreciate what all the input he is providing. Yeah, he's putting in the writing especially. Okay, fine. Now, today we have one letter of Mr. Surendra. So this letter is for Arthur Benson, Mr. Arthur Benson. So our regular patients, that means known case for you, known case for you, but unknown case for the neurosurgeon. So known case, so they are regular patients for you, but they are new to neurosurgeon. That means you are introducing, you are referring them. Okay, fine. Dr. J. Hove. This is the letter. So step by step, are you in for a serious correction, Mr. Muppuraju?
Yes.
Okay, 100%.
Yeah.
Okay, so I'm going line by line as usual.
Yeah.
Right. Dr. J. Hove. J should be a little more clearer.
Okay.
Then this is for all the students who are watching on the YouTube. That is fine. Everyone, line by line, you can check from where what word is coming and how it is matched into the picture. Neurosurgeon. Spirit Hospital. Wollongabba. Right. Dr. Jehove, neurosurgeon, Spirit Hospital, Wollongabba. Okay. Using the information in the case notes, write a letter of referral. So this is a referral letter. This is a referral letter. Yes. A neurosurgeon. Fine. For MRI scan. So he requires MRI scan. Referral for MRI scan. Referral for MRI scan. Okay. Referral for MRI scan. Good. And the date, my birthday, 12 September, but year is different. Okay, 12 September 2017. Here it is, the last visit. And maybe in the beginning also it might be given sometimes. Nothing is given. Today's date is here. If today's date is not given here, so 12/9/17. So this is wrong presentation. You have to write 12 September 2017. 12 September 2017. Absolutely fine. That's it. How come I can change the color? How is it possible to change the color? Okay. So let's not worry about this. Okay. Next, dear Dr. Hove. This comes from here. Doctor and Hove, and before that, dear. Regarding Mr. Arthur Benson, date of birth 15 April 1992. Okay. Right. Fine. So far, these pieces of information are used. Is the same date. This is the first activity of today. So next, Mr. Arthur Benson or Mr. Arthur Renson.
Benson.
Be clear. Be clear.
Yeah.
Mr. Arthur Benson, who was diagnosed with a subdural hematoma, is being referred for urgent evaluation and an MRI scan if
MRI
required.
MRI
If
comes under
required.
evaluation. MRI comes
Huh?
under evaluation, right? MRI comes
What?
under evaluation.
Yes, yes.
So
So
in the purpose line, I didn't mention there. I
fine,
mentioned
fine,
in the.
fine. You're absolutely right. You're absolutely right. Okay. So that's fine. Mr. Arthur Benson, who was diagnosed with subdural hematoma, is being referred for urgent evaluation. Okay. So that's fine. Okay. Right. That's absolutely fine. Okay. Requires referral. Okay. Right. Is being referred. Diagnosed subdural hematoma. Okay, fine. Very fine. Excellent. During today's visit, Mr. Benson presented with various neurological symptoms such as severe headaches for the past 3 days, dizziness, and blurred vision. Fine. During today's visit, you have to say, has presented.
Okay.
So you are writing in present tense, so try to write in present tense only, okay?
Yeah.
So this is during today's visit. Today's visit means everything should be in present tense, not past tense.
Okay.
Okay, so has presented. Okay, present perfect is equal to past in meaning, but only the difference in tense. Okay.
Okay.
With various neurological symptoms such as, okay, fine. On examination, blood pressure of 160 by 70 mmHg and pulse rate of 98 beats per minute. Wow, very good. Have been recorded. Wonderful. Mild weakness, loss of sensation in the medial aspect of the left hand. with no reflexes on the wrist have been noticed. Mild weakness, loss of sensation in the medial aspect of the left hand with no reflexes on the wrist have been noticed. Okay, you have written have. Very good. But how many things are there here? You have said plural.
It's a mild weakness and loss of sensation and no reflexes. 3 things.
So with no reflexes because of the sensation. Okay.
So we
So
have
you are writing 2 things or 3 things.
2 things.
So where is the end in between?
Yeah. Okay.
Is it a mistake or not?
Yes. Yes.
Mild weakness and loss of sensation. Right?
Yeah.
Be careful. Mild weakness and loss of sensation in the medial aspect of the left hand. Okay.
Second, in the medial aspect of the left hand.
Left hand is one body part. Medial aspect is another body part. Okay.
Yeah.
Body part in the body part. So
Okay.
every body part has to have the. Okay.
Okay.
With no reflexes on the wrist. Okay. Eye examination revealed that he was unable to read 2 line or second line.
Second line.
Then where is second? Why did you write 2 line?
Actually, in case of it was mentioned like that, 2 line.
In the second line. In line 2,
Okay.
you say.
Okay.
Read line 2
Okay.
or the second line.
Okay.
You got it?
Yeah.
It's an ordinal number, not a cardinal number. Ordinal number means order. Okay, second in order. You understand?
Okay. Yeah. So he was unable to read the second line
The
or
second line of
eye chart
the eye chart.
of the eye chart.
Yeah. The chart is
Okay.
named as the eye chart. So the eye chart means specific.
Okay.
And edematous optic disc have been. Why have been?
It's 2 things,
Edematous
right?
optic disc has been observed.
It's a 2
Correct?
things, right? Uh,
Is it
we should
singular or plural?
actually we should two things, right? Was unable to read the second line of the eye chart and edematous optic disc.
Okay. Revealed that
So-
he was unable to read the second line of the eye chart. That is finished.
Okay.
That is finished.
Okay.
Okay. Otherwise, that he was, remove that one.
Okay.
Then if you want to make 2 things and join, then remove this one and say
Okay.
inability to read.
Okay.
Understand?
Eye examination revealed inability to read.
Revealed. Okay. Then no need
Yeah.
of have been observed also.
Okay.
You understand? Actually, you could have done it like this. Correct? You
Yes.
already separated them together actually.
Yeah. Yeah.
Eye examination revealed inability to read the second line of the eye chart and edematous optic disc. Only one disc or 2 discs?
Only one disc.
Edematous optic disc means what?
There is a edema in the optic disc.
Okay, in both the eyes or one eye?
Only one eye.
Only one eye. Okay. So which eye? Left eye or right eye?
It was not mentioned.
So that means the the question paper itself is no problem, no?
Yeah.
So that is, there is no specific, which it's confusion.
Yeah.
So that means after a doctor examining the patient, how can it be that we don't know which eye it is? There are many
Yeah.
jokes. The problem was there in the right leg and the left leg was operated like that. You remember?
Yeah.
Many jokes are there on doctors. Left eye was a problem and the right eye he operated.
Yeah. Actually,
You understand?
the case. Yeah.
So
Actually,
this
the
is
case
what
of.
it is.
Yeah.
Correct?
Yeah. The
We don't know
yeah.
which
Actually,
eye.
yeah. The case notes
Automatic
tells.
optic disc in the right eye or the left eye. We don't know.
No. Yeah.
There is no clarity. That means question itself is a problem, right?
Yeah. Yeah. In the case note, it was mentioned that could not read second line of the eye chart. Idiomatous optic disc on fundus examination.
Okay, that's what I'm telling. Nah? The
Yeah.
clarity is missing.
So idiomatous exam in let's check it here. Idiomatous
So
optic disc on fundus examination.
okay, 1 minute. Let me check here if any other complications, mild weakness, admirals, increase exercise, feeling better, needless advised. Need to expand Panadol. Okay. Could not read second line of the eye chart. That means both the eyes then.
Okay.
Because so when not given, right is not given and left is not given. That means both the eyes.
Okay.
Okay, so it should be optic discs,
Okay.
right?
Yeah.
Could not read the second line of the eye chart. Okay.
Okay.
So normally we see with the first left eye, then right eye, right?
Yes.
So that means both with both the eyes.
Yeah.
So that is why he did not give left eye or right eye, both the eyes. But the mistake is
Okay.
the disc he wrote, that's the problem,
Okay.
right?
Yeah.
If the problem was only one eye, they would have definitely mentioned. So the
Yeah.
problem is not with one eye. That means the problem is with both the eyes, right?
Yes. Yes.
Because eye test taken for both the eyes, not for single eye.
Yeah.
So because disc is given, you got confused, but it is two eyes. Okay.
Yeah. Yeah. Okay.
Fund eye examination will be done only for one eye or both the eyes.
Both eyes.
Then that's clearly understood. No? So
Yeah.
what I'm showing you is how to identify what is the mistake in the case. Of course, maybe this is not an authentic case notes. Maybe somebody has put this letter. Somebody has prepared, and this is not official OET letter, maybe. Correct or not?
Yeah. Yeah.
But some flaw is there. So that flaw you have to identify and you have to rectify as a student. Okay.
Okay.
So this is odometer's optic discs on fundi examination. Okay, fine. That's very clear. When there is no right or no left, that means it's common. Common means both the eyes. That's very clear. Is that
Yeah.
understood?
Yes. Yes.
So you have to clarify that one. See, I am not a doctor. I got a doubt. Then you are a doctor. You should definitely get that doubt and you have to give the clarity. So always question the question, whether it is right or wrong. Then you'll get the explanation and you can provide the solution.
Okay.
If there is something in the problem, you have, if whether there is problem or not there, whether it is right or not there, always question the question. What is it? See, I'm questioning, nah?
Yes.
I'm questioning. So I'm getting, you are not questioning, you are not getting. That's the point. So always question the question. Okay.
Yes.
Eye examination. You can say ophthalmologic examination revealed.
Yes.
You understand?
Yes. Yes.
Can you use the word ophthalmologic?
Yes.
If you use those such words, medical terms, and medical terms are also English terms only. Don't think that it
Yes.
is medical. Okay.
Yes. Yes. Yes.
So when instead of eye, you can say ophthalmological. Wonderful.
Yes.
Okay. Revealed. So now you can change this into passive. Inability to read the second line of the eye chart and odometer's optic discs were revealed. Okay. During ophthalmological examination. Okay.
Yes.
So you are
Inability.
using passive voice, were revealed. You understand?
Yeah. Inability to read the second line of the eye chart and idiomatous optic disc
Okay.
were observed
And
on.
edematous optic disc. Even this is wrong. So you have to write
Okay.
an or you have to write discs. You understand?
Yeah.
By default, it is a mistake now, your sentence.
Yeah.
It is neither plural nor singular. Okay.
Yeah.
Disc can be disc or discs. It can be singular
Okay.
or plural. There is no number here. So by default, it
Yeah.
is wrong.
Okay.
By default, it is wrong. So inability to read the second line of the eye chart and odomatous optic discs were revealed during the ophthalmological examination. I don't know what is the correct word for that one. Ophthalmology. Yes, scientific study of eyes and their diseases.
Yes.
Okay, you can say logical, right?
Yes.
So you could have used that word.
Yes. Yes.
Examination revealed. Okay, on 25 August 2017. 25 August. 2 weeks before. No, even before. Okay. On 25 August 2017, Dash complained of headache 2 times in an year, and mild
Yeah.
sensation of pins and needles were reported. So why do you want to write headache? Complained of headache 2 times in an year. Headache twice yearly.
Headache twice yearly.
Okay, 2 times in an year, twice yearly. Correct?
Yeah.
2 times means twice in a year, in an year,
Yeah.
in a year. Okay, twice yearly you can write. Okay.
Okay.
Okay, twice yearly. Okay. And mild sensation of pins and needles were reported. Now it is fine, nah?
Yes. Yes.
Huh?
Yeah.
Otherwise it is wrong because
Yeah.
he complained of headache 2 times in a year.
Okay.
And mild sensation of pins and needles was reported, not were reported.
Okay.
Sensation was reported, nah?
Yeah.
Then why did you write were reported?
Yeah.
You understand?
Yes. Yes.
Same mistake you have done here also. 2 things you have done and have been observed, you are saying. You understand?
Yes.
Either you join 2 things or separate 2 things and write 2 verbs, or join 2 things and write 1 verb. You understand?
Okay. Yeah. Okay.
Join 2 things and write a plural verb, or separate 2 things and write 2 singular verbs.
Okay.
You are not joining and you are saying that is different. Complained of. Here 1 verb already you used. And again you are saying and mild sensation of pins and needles were reported. Here also the same thing have been, you said.
Okay.
Automatic optic discs have been observed is okay, but disc, how can it be same mistake? That means conceptual mistake it is.
Okay.
On assessment, body mass index was
No. No
above
was.
normal, means was abnormal.
Yeah.
means remarkable, right?
Yes, yes.
Huh?
Yeah.
So you can say on assessment, unremarkable body mass index, sorry, remarkable body mass index,
Okay.
lumbar lordosis, and mild weakness in the left hand were noticed. Fine. Okay.
Yes.
So above normal means more than, right?
Yes, yes.
So you can say abnormal, or you can say um,
On assessment, remarkable body mass
what do you
index.
say for body mass index if it is more than normal?
Obesity.
Then write that, na?
Okay.
Huh?
Yeah.
Write that
On
one, na?
yeah. On assessment, obesity, lumbar lordosis, and
As you are
mild
saying, body
weakness.
mass index was above normal.
Yeah. So,
So
we
you
can write.
just say, na?
Yeah, we can write
On
like this.
assessment, obesity, lumbar lordosis, and mild weakness in the left hand were noticed. Fine.
Oh, yes.
Reduction in weight and increasing exercise. Weight reduction.
Weight reduction.
Why do you want to say reduction in weight? Weight reduction.
Okay. Weight reduction.
And exercise, increasing exercise. No, does not match there.
Enhancement in exercises. Yep. Up.
Advised
Yeah.
to reduce weight and increase exercise. Okay. Weight reduction
Okay.
and increasing the duration of exercise.
Increase the duration of exercise. Okay.
Weight reduction
Okay. And increase the duration of exercise.
and increasing the duration of exercise.
Increasing duration of exercise.
And not only duration of exercise, and intensity of exercise also maybe.
Yeah.
Increasing the duration and intensity of exercise. Increase exercise, two things. One
Yeah.
is the intensity and the duration, right?
Yeah.
Okay.
So
you can write that one.
Weight reduction and increasing the duration and intensity of exercise.
Okay. Yes.
For advice.
Reduction in weight reduction and increasing the intensity as well as the duration of exercise. So end is already there. So we are changing it to as well as. Weight reduction and increasing
the intensity as well as duration
okay.
of exercise.
Intensity and duration of exercise were advised. You have a problem, some grammatical concepts today.
Yeah.
Okay, is that clear now?
Yeah.
Weight reduction and increasing both. So both the things, duration and intensity of exercise.
Yeah.
Were advised. So you can also say recommended.
Okay. Weight reduction and increasing the intensity and duration of exercise were advised.
Yeah.
Okay.
Full stop. And doing successfully. Who is doing successfully? He is doing successfully. That's fine. That's not necessary. You have recommended and that's fine.
Okay.
If he is not doing, then you have to mention, nah?
Yeah.
Okay. He's doing, that's why finished. There ends the matter.
Yeah.
Is not compliant, then you write. This is not necessary.
Okay.
Recommended, that means he's doing. If he's not doing, then you
Yeah.
have to mention that. If he's
Okay.
doing, why to mention that is implemented? Finished. A history of
Okay.
asthma which has been treated with steroid inhaler since childhood and allergic to penicillin. A history of asthma okay, he has a history of asthma which has been
He
treated
has.
with steroid inhaler since childhood. So you can say a history of asthma, comma, which has been treated with steroid inhaler since childhood, comma, is registered or is reported. Okay.
A history of asthma, comma, which has been treated with steroids since childhood, comma, is reported.
Yes.
Okay.
A history of asthma, comma, which has been treated with steroid inhaler since childhood, comma, has been reported. That means a history of asthma has been reported. Okay.
Okay. Yeah.
Allergic to penicillin. No, allergy to penicillin. Or he is
Allergic.
allergic to penicillin.
He is
Or
allergic to
allergy to penicillin. He is allergic to penicillin or allergy to penicillin.
Okay.
So break this.
Okay.
A history of asthma, comma, which has been treated with steroid inhaler since childhood, comma, has been registered
Reported.
or recorded. Has
Okay.
been recorded. I'm not writing all those things, okay?
Yeah. Yeah.
So you can
I'm
take the
check.
picture of that one and send me afterwards whether you are written correctly or not. I'll notice.
Yeah.
Allergy to penicillin, not allergic to penicillin. You can write
Okay.
he is allergic to penicillin or allergy to penicillin has
Okay.
been noticed.
Okay.
He is allergic to penicillin or allergy to penicillin has been mentioned.
Okay.
You can say he is allergic to penicillin or
Allergy
allergy to penicillin
to penicillin has been reported.
registered or noted or no or mentioned. Okay, something like that. Passive voice is the second one. First one is the active voice.
Okay.
Okay, next one. Socially, he's a why do you want to use the word socially? What is it adding there? He's a computer programmer. Okay.
Yeah.
It's not a social thing, it's a personal thing.
Yeah.
Okay, non-smoker is personal thing, drinking is personal thing. Why are you writing socially?
Okay.
Fine, no problem. He's a computer programmer. Do we need that one?
Yeah. Actually, it's a neurological condition, so he works very hard.
So it is related to eye, right?
Yeah.
So okay, fine. He's a computer programmer. So she's non-smoker but social drinker. Non-smoker need not write, right?
Yeah.
If he's a smoker, there may be some problem, so you have to write. But this is not smoker, so why do you want to write that one?
Okay.
Correct or not? Social drinker. Regular consumption of alcohol on social occasions has been okay. Like that, you can write regular. Consumption. Alcohol consumption.
Alcohol consumption.
Alcohol consumption on social occasions has been reported. right?
Yes.
Is that clear now?
Yes.
Don't use the word drinker, smoker. It's nonsense. It doesn't look fine, you know.
Yeah.
You are labeling the person as a drinker or smoker. That means
Yeah. Okay.
talk
Alcohol
about the
consumption.
problem, but don't talk about the person. Okay.
Okay.
You have the right to talk about the problem. You don't have the
Okay.
right to talk about a person. If I smoke, that is my problem. If I drink, that is my problem. Who are you to comment on that one? Correct?
Yes.
Don't comment on the person. Comment on the problem. So see, I commented on the problem. I did not talk about him. I talked about the problem there. Alcohol consumption on social occasions has been reported. That's all.
Okay.
So I made it the subject and you are making him the subject. He is a drinker.
Oh.
He is a smoker. You are talking about him.
Okay.
Okay, that's not fine. Never label the person as drinker, smoker, or something like that.
Okay.
People will get offended. So he's a computer programmer. Okay, that you can write it separately, no problem. Okay.
Yeah.
Right, next. Okay. Right. He had a car accident 3 months ago. At that time, he was hospitalized for 24 hours without complications and CT scan was normal. Instead of normal, you can say unremarkable.
Okay.
Better word.
Yeah.
He had a car accident 3 months ago. Start with 3 months ago.
Okay.
This is the platform. 3 months ago. Start with this. 3 months ago,
Okay.
hospitalization for 24 hours.
Hospitalization for 24
24
hours
hours. Following a car accident.
following a car accident. Okay.
Okay. 3 months ago, hospitalization for 24 hours.
Following a car accident.
Following a car accident has been informed.
Okay.
Okay. Okay. CT scan was unremarkable and the condition was uncomplicated.
So 3 months
CT
ago,
scan was unremarkable.
And the condition was uncomplicated.
Yes.
Okay.
See how you want to write, you write. There are 101 different ways of writing. Okay.
Okay.
See the best one which you feel comfortable.
Yeah.
This paragraph is not that okay.
Up. Yeah.
So he had a car accident 3 months ago, and at that time, during which, so you could have written like that. 3 months ago, he had a car accident during which he was hospitalized for 24 hours, and there were no signs of complications, and the CT scan was unremarkable, like that. Okay.
Okay.
I cannot write everything because this is not typed. I have sent for typing, and after that I'll show the improvements. Okay.
Yeah. Okay.
So if possible, daily you can write and correct and type and send immediately. Okay. So
Yeah. Okay.
yesterday's letter I will schedule for improvements today. Okay. Now only I'm correcting.
Yeah. Okay.
Why do you want to write CT scan? Write computed tomography scan. Okay.
Okay.
Don't write short forms, as far as possible.
Okay.
Was unremarkable. It would be highly appreciated if you could arrange an urgent MRI. Avoid writing this style of letter.
Okay.
It would be highly appreciated if you could arrange. This is not very fine way of putting. It
Okay.
would be highly appreciated. Why should you appreciate somebody?
Okay.
Something when he is doing his duty. If
So-
you could arrange, why so request so much?
Okay. So
This
we can
much
write
request
based
is
on.
not needed. You are a professional and he's a professional. Both are equals. Professional
So we can.
brothers.
Yes.
So,
Yes. So we based on the
so no
formation
need of
circum-
too much request. It's a formal letter, will not have too much request. Okay.
Yeah. Okay.
So you can write
Based on the formation
after
circumstances.
taking the above all the above conditions in okay, consideration, after considering all the above mentioned aspects of like that one. Okay. In view
Yeah.
of the above mentioned discussion or above mentioned circumstances or aforementioned circumstances. Okay.
Yeah.
An urgent MRI would be profoundly beneficial.
Okay.
An MRI on an urgent emergency basis. An
Okay.
MRI, performing an MRI on an emergency basis would be profoundly beneficial. So
Okay.
let me write the sentence for you. Based on the aforementioned circumstances, comma, performing. Is it performing an MRI scan? Performing a scan, right?
Yeah.
Performing CT scan, right? MRI scan.
MRI. Yeah. MRI.
Okay. Performing an MRI scan. What is MRI?
Magnetic resonance imaging.
But what is that?
Magnetic resonance imaging.
Magnetic resonance
imaging.
imaging scan. MRI scan would be profoundly beneficial. Okay, scan on an urgent basis. On an emergency basis. Or on emergency grounds. Understand?
Yeah.
Would be profoundly beneficial. Okay, that's enough.
Yeah.
That's fine. So urgent evaluation. Okay. All right. Twice yearly. Twice yearly. Okay, fine. So based on the aforementioned circumstances, so that's the point.
Yeah.
Based on the aforementioned circumstances, performing a magnetic resonance imaging scan on emergency ground would be profoundly beneficial.
Okay.
Fine. Emergency grounds would be profoundly beneficial. See, I made a mistake. I did not put a C, but now I checked and I have put. So mistakes anybody can do. So we have to correct them. Next one. In case, comma, any additional information, please do not hesitate to contact me. That is correct. So I did not correct it. So that's fine. So we can put it up only. I thought I had to add another sentence. So I put it there. So that's it. In case, gap should be there here.
Yeah.
Yours sincerely, general practitioner, 1, 2, 3. Okay, fine. And where are you, general practitioner?
It's in the task.
You are a general practitioner, you wrote. But why
Yeah.
did you not write a suburban clinic?
Yeah. Yeah.
Huh?
After sending your after
Arthur
sending to your
Benson
case.
and his family are regular patients.
Yeah.
Okay. So do you have any state or country or anything related to his presence where he is
No.
staying?
No. No.
Not given. Not given. Okay, fine. Yeah, that's fine. Is that clear?
Yes.
Any doubts do you have?
No. No.
So, fine. You have to improve your handwriting a little, okay?
Okay.
What do you do is first you write in 1 hour, sorry, 40
Okay.
minutes. Then afterwards take a new paper and try to write, make it a habit of writing neatly. Okay.
Okay.
At least because of my fear that I am cutting you down, you know.
Yeah.
So at least because of my fear, slowly, you will transform your handwriting.
Okay.
Okay.
Yeah.
See your S is, what is this? Is it looking like S? This S is not very fine.
Okay.
You're cutting short. Okay. So
Yes.
like that, handwriting, you're trying to do your best, but not still. Okay.
Okay. Yeah.
It should be round handwriting. Okay. Letters should be very round. That is the
Okay.
beauty of the letters. Okay.
Yeah.
Okay, fine. Now file, I'll post it there.
Okay.
Save as. Okay, feedback round 1. So today evening I'll give you feedback for yesterday's letter. Okay, today's letter I'll get typed and I'll get it in the night. So tomorrow I'll correct that one. Okay.
Okay.
I'll give you improvements and suggestions in the second round.
Okay. When can we
Okay,
have speaking session?
are you comfortable with this?
Yes. Yes. Yes.
Speaking, you call
Absolutely.
me around 5 o'clock or 4 o'clock, after 4 o'clock.
Yeah.
Because now I am in the writing corrections free. Okay.
Yeah. Yeah. Okay.
So how do you feel regarding the improvement, Dr. Surendra Muppuraju? What do you feel
Right.
regarding your improvement based on my feedback? Because
Yeah.
your feedback to this, your feedback in this video session. Okay. So are you comfortable with your video? Can you come on the video or just want voice only?
Yeah. Yeah.
Huh?
Can you see me?
1 second, I will just put it. Okay. Okay. Yeah, I can see you.
Yeah, it was excellent corrections.
Yes, yes. Yes, Dr. Surendra.
Yeah.
Okay, let me check how to sort this one out. Yeah. Yes, Dr. Surendra.
Yeah.
I cannot see you again. Yeah. So now tell me your experience regarding these corrections and how you are improving. Okay, what is your feelings regarding the sessions and okay,
Yeah, it was a great session, and day by day I was improving a lot.
okay.
And you are correcting.
Set the screen properly. No, your computer is shaking. Or
Yeah,
like that's fine. That's fine. Yeah. Tell me.
yeah, you are correcting like a grandmaster. So I can,
Okay, that's the title of my session. Okay, right.
and you are doing also same way.
I'm doing actually research, open brain surgery, you say, open heart surgery, you say. I am doing open brain surgery in language, related to language.
Yeah,
Okay,
yeah.
I'm doing surgery on you. Okay, tell me. So after this session, what areas you improved, you think?
Uh, Actually, I need to improve on the articles and usage of tenses, and I need to improve on action plan.
Right, that's fine. And regarding your, what do you say?
I need to improve on handwriting also.
Handwriting, yeah, handwriting is the most important. Actually, the first impression is the best impression. So before you read something, you see the beauty of the letters, you'll be impressed. You want to read, you'll be forced or motivated to read further with a
Yeah,
liking, some sort of interest. So that
yeah,
you have to build up. That will make you, that will help you only if your handwriting is fine. Okay.
yeah,
Right, right, right. Okay, for example, you have your friends, you are a young person, young chap from Philippines, medical college, you have done your medicine and now you're come here and you have a number of friends. If anybody asks you regarding our sessions, okay, how is the session with Mr. Simon or classical corrections? So what is the
first.
benefit you are getting? Suppose I am the
So
person, I am a student, I am a doctor, and I want to clear this OET and I'm coming to you and approaching you or some other friend is approaching you. And what is your suggestion to him, whether to go with classical corrections and Simon Peter or not? And why? Why is the more important point? Yeah.
first of all, I strongly suggest him to go with you, because your corrections and your the way how to improve the writings were given by you are excellent. So if I follow, I mean, if he follow your advices, he can success in poetry.
Okay.
So
So now, very good. You have given one sentence, but in one sentence, you have a problem in grammar. That is what I'm showing you. So if
yeah,
he follow your advices, you told, correct?
yeah. If he follow your advice, then he
Okay.
will be
So you
benefit.
corrected one. Another mistake is there still.
Yeah.
If he follows your advice,
Okay. Okay. If he follows your,
he, she, it,
yeah,
yes. Okay.
yeah, yeah.
So in one
If he
sentence, two mistakes are there. So you have to
yeah,
rectify such mistake because you may be knowing, you may be not knowing. But so if I tell you which is right and which is wrong, then only you can correct. Of course, you are a doctor, you are a specialist, but your area of speciality is something different.
yeah,
Correct. And no man can be master of everything. Fall.
yeah.
Okay. So you can be a master of something, but not of everything. So definitely you have to improve. So that is what I'm going to tell you. Okay, now tell me why he should follow. What are the reasons?
Because the way you correct the letters, the way you what we call that, the
Yeah,
the way
set
you
your computer proper. Set your computer properly. Yeah.
yeah,
Okay.
the
There
way
are many nurses and there are many doctors who are going to watch your video, this one. And
yeah,
they will be motivated by you, because if I tell, maybe they will think, okay, he wants to sell his course or something. No, I never bother about that one. Correct? People come to me and ask me. I never ask anybody. I never advertise too much. Okay.
yeah.
So,
First of
and I
all,
take only serious candidates. Yeah.
yeah. First of all, I according to me, I likes you more the way you rectify my mistakes and the way you expose my mistakes, and the way you corrected my grammar and each and everything, and you are not leaving even a minute mistake also. You are correcting each and every mistake, and you are exposing me to more for poetry.
Okay, like you, there are some other doctors and nurses whose papers I am correcting, but they feel that I am correcting too much and nobody is correcting like that. That means this much correction is not required. So what is your suggestion for them? Because in many institutions and many tutors, they just they correct the paper in just 10 minutes or 5 minutes, and there are many videos, and okay, they correct on the computer or WhatsApp or on phone call, and they just finish it in 3-4 minutes. But our correction may go for something like more than 45 minutes, and sometimes even 90 minutes it will go. So they think that it is useless to spend so much time on correction. What do you think?
Correcting long time makes us to remember what you made us correct, rectify our mistakes. To rectify our mistakes, it's need to be so long. I mean, not so long. Yes, we need to have minimum of 30 to 45 minutes so that we can learn that mistakes also. If it is 3 to 4 10 minutes, we can't learn that mistakes, and we need to what they are saying we can't understand properly, and we need to ask again and again and again. They might feel discomfort regarding this. If the correction goes like 30 to 45 minutes, what you are correcting, we may get the result and we learn from that. In the same session, we can learn that also. No need to
Yeah.
spend more time again on that.
Okay, my logic for this one is, if I correct 50 letters and each letter correction for 5 to 10 minutes, there is not much improvement, correct?
Yes.
Okay, instead of that one letter I correct for 45 minutes or 1 hour. So the mistakes which you are doing will not be carried on to the next letter, correct?
Yes.
So the number of letters to be corrected will be less.
Yes.
And very fast you improve, like how you have improved.
Yeah.
Correct or not? I did not correct
Yes.
in many of your letters, but there is a lot of improvement.
Yeah.
You understand? So correcting
Yes.
5 letters and each letter 5 minutes or 10 minutes, rather than correcting 1 letter for 50 minutes, it makes much difference, right?
Yes.
So the improvement in others, when they correct 5 letters, the improvement will be after 5 letters. But for you, there may be improvement after 1 letter only, correct or not?
Yes.
Okay, fine. That's what I noticed. So thank you very much, Surendra. So in the evening today, I will schedule a session for your writing round 2. Okay?
Yeah.
For the yesterday's letter. And today's letter you'll get tomorrow. Is that fine?
Yeah. Yes.
And
Yes.
thank
Okay.
you. Have a nice day. God bless you. Bye-bye.
Thank you, sir.